afternoon everyone. I am Dr. Rashmi Chaudhary, the Senior Obstetrician and Gynaecologist in Cloudnine Hospital, Bellandur, Bangalore. I have a working experience of more than 26 years in the field of obstetrics and gynecology. My area of specialization is the management of high-risk pregnancy and the complicated gynec surgeries. This is basically a vaginal birth after a previous cesarean section delivery. The concept is that once a C-section, always a C-section. This is not true. A woman who have a previous cesarean section can still have a normal vaginal delivery, provided there are certain criteria for that. If they fit into that criteria, there can be normal delivery. So who are the right candidate for VBAC? The right candidate for VBAC is that the woman who have cesarean section because of the non-recurring conditions, like woman has placenta previa, this is not necessary that it will recur in future pregnancy, or she has a cesarean section for breech presentation where the baby head is upside and woman has to undergo C-section for that, or a woman was in labor and she has cesarean section for fetal distress, or baby heartbeat has started dropping, or she had a baby had passed meconium and because of that cesarean section was performed. They are the good candidate for having a normal delivery even after one cesarean section. But very important criteria is that they should have a cesarean section by low transverse incision in their uterus, and the ideal gap between the two deliveries should be minimum 2 years. That is very important. Conditions where we don't advise the VBAC is the woman who has undergone cesarean section by classical method, where we give a vertical incision in the upper uterine segment. They are not the right candidate. If they are having a multifetal pregnancy or a twin pregnancy or triplet in this pregnancy, then they are not advised to go for VBAC, where we don't do. Or if they are having placenta previa in this pregnancy, then also we don't suggest. Or any medical disorders like diabetes, hypertension, or advancing maternal age, we are not advising the VBAC in these type of patients. So what you should be doing? You should share your concern with the doctor. People, they often ask this question that, doctor, can I have normal delivery even if I had a C-section? Will it harm my baby or I will be having any problem? Normally it is not. Normally both mother and baby are safe for after a VBAC. There is no problem. But you should be also doing certain changes in your lifestyle, like avoid excessive weight gain. There should be minimum gap of 2 years between the two pregnancies. Your lifestyle should be regular. You should go for some regular walking, 30 minutes walking daily. You should do a prenatal yoga, practice it under the supervision of the physiotherapist or expert. And this prenatal yoga and breathing exercises will help your or improve your stamina to bear the labor pain in the first and second stages of labor. It will improve your lung capacity as well, and follow your multivitamins and all whatever has been suggested to you. If you are looking for a VBAC, you should always have an institutional delivery where 24-hour anesthetist and obstetrician are present. So if at any stage of labor, if there any problem to the mother and to the baby, if it happens, then it will be taken care immediately. So institutional delivery is always advocated in a VBAC. The advantages are too many, like you will have a shorter hospital stay, infection chances are less, post-operative paralytic ileus is less, and your recovery is much faster.